We got a professional motocross rider who was in a race the other day. He was going over a big jump. He landed and he popped his Achilles tendon. He ruptured his Achilles tendon. You can see on the video, he knew he did it immediately and he pulled his motorcycle off to the side. We're going to go in there, we're going to make a small cosmetic incision and we're going to repair his Achilles tendon, get him up walking, and have him back to riding his motorcycle in no time. Let's go take a look.
Achilles tendon repair equivalent with plasma injection.
So when somebody comes in the office, they say that they feel like they got hit in the ankle with a baseball bat, or they feel like they got shot. This is how you tell if it's the Achilles. So you can feel the tendon with your index finger. So this is a very easy clinical diagnosis. If you just ask them to point their ankle, they'll be able to do it. You got the flexor hallucis longus, the flexor digitorum longus, the posterior tibialis tendon. So you got other flexor tendons that will point the ankle. This is called the Thompson test. And if your Achilles is intact and you squeeze the calf, the toes will go up. But when it's ruptured and we do it, it doesn't move. So this confirms that the Achilles has been ruptured. We used to make big incisions like this one.
Oh, wow.
And now we do tiny little incisions like this. And I got a nice good bite of the tissue. This is what helps us pass the sutures. We want to slide this in between the tendon and the tendon sheath on the inside. So once you get in, you kind of dial this apart. So now I'm up in there. The needle's going to go through here on the outside, through the skin, through the tendon sheath, across the tendon, then out this side. So we're going to leave that one and do it last. That way it's holding the tendon down. So that once we pass all our sutures, we'll pull this thing down, and this is going to pull all the sutures that we pass on the inside of the tendon sheath and out the wound. And then we'll do the same thing on the bottom, and then we'll tie them together. So you pull this way, and now all these sutures are through the tendon and inside the tendon sheath on that side. See, I've got a good bite of the tendon. Let it go. Nice. It will pull on. So we've locked the tendon in. Excellent. So I used to make a little stab incision here, stab incision there, stab incision here, and we would take a long needle, pass it through the tendon that way, that way, that way, so we had it, and then we did the same thing here. I would have 6 little pokes, and it was hard because you had to avoid getting the peritoneum caught up. Like you had to get just the tendon and not the tendon sheath. It wasn't that easy. Now, Thompson test. See? But when it's ruptured and we do it, it doesn't move. Now it's connected.
Look at that, look at that.
Okay, that case went really well. We were able to get his Achilles tendon repaired through a very small, minimally invasive cosmetic incision. It was almost so small, once I got it closed, I had a hard time seeing it to put my steri strips on it. So we want to go inside the tendon sheath and bathe all the tissues with the anesthetic and with the platelet-rich plasma. So we put a dressing on it, we put him in a splint. He's going to come back to the office in a couple of days. I'm going to take that splint off, and we're going to put him in a removable cast boot. And the beauty of that is he can take the cast boot off and he can take a shower and he can start working on physical therapy right away, working on motion of his ankle and starting to get things moving. And this is going to allow him to have the fastest possible recovery. He's going to be weight bearing as tolerated from day one. So once we get him in that boot, he'll be able to start walking on it, which is also nice when people are convalescing. At 6 weeks, we'll let him start walking around the house with no boot. And then when he goes out of the house, we'll wear a boot. We're going to be careful for about 12 weeks. And at that point, the tissue should be strong enough that he can start riding his motorcycle again. This case went really well. I'm really happy for this guy. We'll catch you next time at Barbour Orthopaedics.